Hello, welcome. Welcome to this panel, Comea Nova Summit, the largest health innovation meeting in Latin America, an FIS initiative event. And I thank the opportunity to be here as a mediator in this panel. I am Leonardo Gross, head of digital and healthcare solutions at GE. And I am so happy to be here with you today. The topic of our panel is transforming data into assets for organizations. And it is fantastic to have Claudio Franco, Chief Marketing Officer of Gympass. He's an electric engineering at Unicamp University, and he has worked in Compet Gable. Thank you, Claudio, for your participation. We also have Marco Aurélio Costa, CEO, Americas Medical Services, UHG Brasil. Most of his career abroad, and 1 year ago he took office in this new position, and he's a researcher, medical doctor, manager, and last but not least, Rogério Boros, Director of Health and the federal government, Microsoft Brazil. Welcome you all. And this is a fantastic opportunity to interact. Take this opportunity, voice your concerns, make your questions to our 3 brilliant participants. And when we talk about data, we talk about the data economics, and the healthcare sector inherits a challenge, which is an obstacle we have to overcome in other sectors, which is data explosion. I want to start the first part of our panel exploring this topic. We know that the healthcare segment is very good to generate data, but we know that it is an endless array of data. But can we use data that can promote development, deliverables and insights that have an effect in healthcare? We have a lot of information, we have a lot of data, but it is not really used to help decision-making in their better informed decisions, to improve operational efficiency in such a critical moment in which resources are so scarce, in an environment in which the pandemic is still relentlessly present in our lives. So to put everything into context and to talk about the explosion of data, 30% of stored data in the world come from the healthcare and well-being sector. And a middle-sized hospital produces 30 terabytes of data. These data from in image diagnosis and other sources, e-records, digital systems, all of these sources produce data, a lot of data. So let's try to talk about this topic. And I know that GE, and just to give this further dimension, is present around the world with 4 million devices installed in hospitals, 1 million in image departments, more than 60,000 screens per minute in the world with GE devices, a lot of information that can be used in decision making. And I start asking our guests, and I really want to know what you think about this. Data is the new oil. This was coined by Clive Humby. Data is the new oil. But if we analyze this effect phrase in detail, we realize that without processing, data can be used, raw data can be used. We have to add value. Unlike oil, data have no intrinsic value. It depends on withdrawing information, relevant information from data, and do something with data. And I want to go straight to the point in our conversation. which are the key elements to transform data into new sources of revenue. Where do you believe lies the greatest gap in the healthcare sector to transform data into assets and into value? Don't forget to make your questions, everybody in the audience, because I will ask your questions to our guests. Claudio, what's your take on this? Well, first of all, it's a pleasure to be here with this group of specialists in different sectors in healthcare and well-being, representing the newest business of the three, a native digital company. And it's a pleasure to be here in this conversation. Well, Leonardo, when you talk about challenges in the last 10, 15 years, we have overcome everything that has to do with economic viability of storage, processing, data treatment. And today I can positively say that this is, of course, we have cloud services, we have new technologies, data engineering, data treatment. This is no longer a challenge. So it is great that we have overcome so many barriers, but there are challenges in this area in the healthcare sector that somehow can be a threat, but also an opportunity if we get our act together. And I think it is one of the products of this Innovation Summit, KISS 21. First of all, privacy. Healthcare is not a financial asset. Health care deserves and demands special care with privacy of data and individual care. We have made progress with the General Data Protection Act and in Europe with GDPR, that is the legal framework in Europe. But I think that sometimes it could be a barrier because data sharing should be done very carefully. There is no clear guideline or a chapter about privacy in data. So this is a challenge we should talk about, and we have to include this in the agenda because data sharing with entailed barriers should be overcome. And what about standardization? When we talk about data sharing, it's important to talk about data sharing. Let me give you an example with language. I need to know language, grammar, and how I record, how I share language. So, in spite, organizations individually maybe record data, store with all care. I think that the highest potential is the one that we have when this is done in a structured way. De nuevo, mira. Caiu, Laura. Caiu.
Cash generation and insight, etc. This is a bit of my vision, these great challenges for us to further explore the potential of the new oil that is data. Excellent. So we have Rogério, one of the big techs in the world that generates revenue essentially from data. Rogério, tell us a little bit. Can you list what elements essential elements that are those that the companies can actually generate new revenue sources, and that you see potential gaps to get there. First of all, I'd like to thank you for the opportunity for being here, this initiative event. And I think we can split your question into some parts. First, in this healthcare process, we have something that is procedural. So the patient go into a clinic, etc. We have a process as to how they're going to be cared for in a public, private process. You will have a structure that is procedural with actually scheduling of tests and processes. And then we have a great opportunity of your having innovation with data on that, using AI to detect, based on various factors, what is the predictability of permanent stay of that patient in hospital. That may be used to negotiate with a health insurance company for certain negotiation, etc. Another interesting point is for you to look at the electronic clinical record of the patient. Increasingly, you have information on patients, and there's something that is happening, adding to what Claudio was commenting. Data SUS, so this is the public health system data, they have information based on the national healthcare information data. People, all hospitals, clinics, and laboratories, public and private, have to be connected to that. Today, it's only connected for COVID tests, but the trend is to be general. And every citizen with diverse information, we have all the information of citizens and the whole clinical track record of the patient. So this is being done, and what's happening is actually something based on a road movement that came on fire. Fast health interoperability response, which is a system for data interoperability with safety. This is a boom for healthcare data in healthcare. So if you look at studies and the exchange of data between healthcare entities, it's only 14%. Even if you get to healthcare providers, this doesn't go beyond 30-40%. And this will bring great innovation opportunities in another industry for you to use data, now not only for procedural, but very much related to the hospitals, how they operate, the structures, but also for diagnosis. And we start having data handling geared to analysis that is actually of diseases and specific things. Part of this is already happening with genomics. Genomics, basically, you use cloud processing data, as is being mentioned, or how to mention. So actually, we have the processing, you have AI, and you talk about genomics. It depends. Well, you can actually 200 gig. You cannot process and store that in your central data center. You need to have flexibility for growth. This is an opportunity that is great for diagnosis. And now we're getting to a third stage of your starting to use this data. Let's take, for example, radiology test, MRI, and we're starting to have assisted operations. You're having a doctor, and we can have an example to me, impactful. I'm not a doctor like Dr. Marco. He knows about that. So I'm an electronic an engineer. I'm a fan of healthcare. So in healthcare, we have a case with doctors using holographic assisted surgeries. For example, a brain surgery, you're going to actually have 2 vessels to a non-irrigated depth. So in average, you had to have 2 CT scans, have a risk of 2.2 centimeters surgery that would take possibly some hours today. With this, we managed to reduce from 2.2 to 0.22 millimeters. The cut and 1 CT scan required. What does it mean? Significant cost reduction and a result that is much better for the patient. So the patient as much lower risk because of the whole surgical procedure and better recovery possibilities. So we collect data in other ways and we start using it. And the data that were used only for analysis, for planning, may be actually used throughout the patient's journey. If we start stratifying, we have other opportunities. And there's another one that is yet very significant. For a long time, the development of drugs and treatment is very much related to pharmaceutical companies, innovation companies, and increasingly it's linked to the hospital, to the very end, because you have the data as to how patients have behaved over many, many years. If you look at personalized medicine, what has to be done to that specific patient based on the patient's medical record, the family's medical record. Nobody has this information. You don't have that. Actually, Leonardo, we work a lot with data. We work in allowing our customers to use the data in an intelligent way and perhaps create a new business. They start creating a new procedure that may be adopted by hospitals and companies all over the world, from innovation with artificial intelligence, various analysis that you make based on your data that we start having in medicine. And I let Dr. Aurélio Costa to say that science is an empirical thing. It's based on measurement of what happened to a group, populational group. It's not mathematically defined for any case, any individual in the world. It's actually defined mathematically to an expected behavior in the world. So being empirical data collection is fundamental because you can use the data in every populational group, every segment, every country, every socioeconomical scenario, and even environmental. Everything may be impacted in this scenario. Otherwise, we have variations of COVID and other things. And I think there is an opportunity that is huge for innovation. This is an industry that will suffer a lot of innovation from here with data available, with regulation, so that this data can be accessible with privacy and safety. Two fundamental points for the rest. This is very important in healthcare. Excellent, Rogério. Thank you for the insights. Now we have this hint for Marco. Marco, bring to us this viewpoint, your viewpoint from the standpoint of healthcare. So do you have Ali? So good afternoon. It is a pleasure to be here. I think, the doctor represented here, or representing medicine in this panel. So I have a medical degree in Europe, and I have a PhD from Europe. Then I went to the US, where I spent almost past 20 years. I've been in Brazil for less than a year, only 10 months. Actually, when I arrived, this has been a privilege of being able to follow on. And I found a company that offers me a great opportunity of practicing. I found a very wealthy atmosphere that is to collect data. So actually it's been organizing itself in Brazil. So in social economic situation in the world, I lived the pandemic in the US. I'm reliving it in Portuguese and English. And I actually believe that there is great opportunity. I think you put it quite well. Healthcare problem is not lack of data. We have a lot of data. You are engineers, so I think it's easier for you to formula an optimization model. If we were to create a model, mathematical organizational model, you have a database, you have constraints, we have several variables on your database to generate the possibility for you to attain your goals. I was excited, doctor and as a data scientist. Well, what's really interesting is the purpose function. So the objective function. As a manager, I see this as what is the purpose of using these data? What is the purpose of your business to connect people in a digital way, or generating image technology of high specificity and accuracy as you produce, or connecting people in a fluid way to create interoperability? If we think about our company and know what our purpose is, and then we're going to be able to use the data and turn that into technology. Technology is the driver, information and data are the inputs. The outcome is using the data. In healthcare, I'm in the area of technological medicine. I'm a cardiology. I've been a researcher for many years. I've been a professor for many years. And it's interesting, when I migrated, went to MIT in search of this data, and I was part of the data analysis program, I realized that I had worked for over 20 years with very advanced technologies than the wearables, than sensors that were operational. I worked with 3D images in the heart beating at a very great speed for me to be able to inject stem cells, so to have different generations. So I was working at a very advanced technological world, and we were trying to attain superficial levels in society. Well, basic data, temperature, heart rate, totally basic things when you discuss these things with doctors. So we have to understand what is information, what are the data that are going to improve the purpose of this doctor. It's very nice to talk about wearables or athletes, for example, but we need to understand what the purpose is from the standpoint of medicine and healthcare service. Today, we're 18 hospitals, 39 clinics, 27,000 associates, 25,000 doctors, 1 million visits in our outpatient clinic and ERs. We have no time to use and process data in the way the world expects today. I think from technology, for example, from Microsoft and GE, you understand this. When you are interacting with healthcare systems, there's a gap. What do I need to improve my purpose, which is saving life or lives? And how can you deliver the data? Perhaps the problem is not data. We need more data, but we need data that are more in line with our purpose so that we can optimize our role, that is saving lives. So that I leave it open for us to continue our conversation.
So this is the possibility to transform lives. Everybody wants to know about Gympass cases in the pandemic. Gympass experience in the pandemic was a great experience to reinvent a lot of business lines. And Gympass needed to reinvent itself, especially in this business, especially in gyms. And you had to transform your company in weeks. And that decision-making was extremely important and strategic. Decision-making, quick delivery, so that Gympass could keep up with your expansion plan in 10 countries. How did data help you make those decisions so that you could, for instance, and I'll say what Gympass Wellness, what data-oriented decisions were made and which were the barriers you overcame for a company that grows by 100 to 100% a year with this new system, pandemic situations? Thank you for the opportunity and the question, Leonardo. This has been my life. In the last 13 months, I still remember I received a call on Sunday. It was my boss telling me that there was a quick dissemination of the virus in Europe Italy, remember, Italy was the first country affected, and Italy is amongst our 10 countries, and we needed to understand what we were going to keep up our business because we closed all our gyms in Italy. And we have a marketplace in our business that 13 months ago, we were service providers, face-to-face services in gyms, in centers, in studies, and we have collaborators in companies that believe that wellness, it has to be accessible for everyone, personalized. So somewhere in the middle, we connect the demand with the supply. And in a couple of weeks, I mean, literally 2 weeks, there was a very quick progress of the disease here in the West. The COVID was here in Brazil, and in a couple of weeks, we were living the same lockdown situation as in Italy. That was the first country that was greatly affected in our business. So, I mean, no more supply. We had nothing to deliver, but our mission to transform people in more healthy people, wellness for everybody, and our clients that believe in our premises and purposes were the reason why we kept on working. We had to find a solution for the pandemic. And what did we do? We looked in our new ideas, new products, new innovation portfolio, and what we had was a sub-marketplace for well-being solutions outside of gyms or closed spaces, with 5 apps developed by partners that wanted to distribute our content in our base of members. It was a pilot for 50, 100 people, and in 2 weeks became our product number 1, the first client where we delivered this product was in the marketplace. And first we started monitoring closely the evolution of cases. Google didn't make data available. Financial Times was the first reference as reliable data source, and the first app had to do with this, how each of the 10 countries were reacting to the pandemic, and what did this mean for customers that used our products in just 2 weeks transformation. So this was the first thing. We had a war room that was working 24/7. We would meet very early here in the Americas, and we would have late night meetings to understand what had happened the day before. And that was it. And then from then on, we launched 2 new products, 2 totally different new products, different from anything. The first one was a digital transmission platform for wellness content. And we offered this for all of our customers with Pilates, yoga, functional, physical training. I mean, all of the different modalities that could be transmitted online with quick adoption. And it was similar in all the countries that we do business in. And it was a total online delivery. What we did was really, we have a lot of information. We store everything, even though we have no purpose of it all, we store everything. And this helped us understand what type of schedules, timetables, and classes were more interesting. And we had to build an agenda that would be tailored to the new reality. We realized that peak times in face-to-face classes are exactly the same. 7 a.m., 8 a.m., 9 a.m., and then they drop till 6, 7 p.m. in Spain, Italy, everywhere. But then we started realizing that the routine changed, and there were other prime time classes, we would say, that would have been possible face-to-face. For instance, you want to wake up a little later and start at 8 a.m. because you didn't need to go anywhere. You didn't need to take the car. You were not going to be in a traffic jam to go to the gym and office. So commuting time was cut. And this gave us the possibility to have more flexible schedules. Another peak we identified was lunchtime, 11:30 till 1:30 p.m. Yes, in face-to-face gyms, we had a lot of public, but when you remove commuting, you can meditate 20 minutes or half an hour before going back to your obligations in the afternoon. So digital platforms were very, very popular in this lunch break between the morning and the afternoon sessions. So out of a total of possibilities and tests run to monitor user behavior in this new environment where we had no experience at all. So, and then ultimately what we did was to create the first product we worked with, which was peer-to-peer. We created a connection between personal trainers, that is individual service providers, in dedicated classes for anyone in the world that wanted to take a class with a super personal training from Rio de Janeiro. That is, if you want an appointment with this personal trainer, you could. And the synchronicity of supply and demand is very specific, a specific modality in a special time slot for this person, especially in the fitness industry, where we have a more flexible possibilities. We have RuPaul, New Fit, Company Atletica, other partners that have the possibility to make this demand flexible. But when it's one-to-one, the match between supply and demand needs to be perfect. And so demand growth was really fast. And we had to really see individually, case by case, how we could guarantee a good user experience in an unprecedented model. We have more than 5,000 personal trainers working on a daily basis in our platform, some 100% with 200, 300 classes per month, which is totally impossible in face-to-face classes. And another example of data application is that when cases started becoming more controlled and vaccination started to go faster in the United States and Europe, we saw that there was a total shift, a dramatic shift in the behavior of users. And we realized that the United States was the first country to make COVID protocol rules more flexible in fitness establishments with a very quick recovery, but that changed from city to city. The government of New York, that was a little more careful and strict with rules, whereas the government in Texas were more flexible. So even today, we have an internal index of commitment recovery, and we measure every single indicator per city, per user, per time slot, everything that's available. And this all helped us adapt ourselves more quickly to the recovery of economies and face-to-face classes. So that's the dashboard I look at in the morning, and also to anticipate movements, that is the information that time slots of functioning hours in a gym will change on Monday. And sometimes we get this information on Friday. So we have our own behavior estimate indices to make better decisions, to make quick decisions, so that we can compare what's going on in the market, anticipate, not be waiting months and weeks to understand what's going on, or if there is any symptom of recovery in the economies. Well, I could give you hundreds of examples, but I guess it is the beginning, the middle, and now the transition towards a reality that I don't know, Marco, I don't know if you know what happened 10 months ago, but in the United States, most of the population is already vaccinated, and some cities in the United States, with the exceptions of the using of masks and distancing, because vaccination started quickly over there, and economy is recovering, fortunately. Yeah, what a turning point. It's really fantastic, and your tips are great. And you give us examples with cases. It's inspiring for everybody. And I want to keep on talking about game changing. I mean, Rogério, I have been with you in other seminars, and there are some trends that show that the current healthcare scenario is of an industry in a transition process. You talk about trends, and you say that many patients are unsatisfied with service provision in healthcare, and we will have 4 million professional vacancies missing in healthcare globally. So my question is the following. With less professionals in healthcare, and since most patients feel frustrated with their healthcare experience, because we have to see whether the cup is half full or half empty. So according to you, which are the elements that, and which are the cases that you can share with us? Which are the key elements to change the rules of the game? How can you commit the patient in this data-driven model, as Claudio just mentioned, with the experience of Gympass? And this is about the possibility of having labor available. And what about this commitment? What is your expectation, Rogério? If you want to share some cases with us, we would love to have your experience in this commitment. And how do we get the magic? I mean, are there any inherent tasks that have to do with data leverage? And how can we measure value data has in this commitment path?
A simple question I can answer in 2 words. First, spectacular to hear the sharing of point that Claudio has shown. Once again, it shows that data can be used to take insight that are going to totally transform your business. And I am not a doctor, actually, Dr. Marco. And I say that I was born, well, I am an engineer who's frustrated for not being a doctor, and I'm actually too frustrated for not being an engineer as a doctor. So I'm happy to work in the area. I see some major points. Of course, these studies, there are general studies that show challenges in healthcare, patients' vision, but there is a scenario. What is the greatest frustration of patients? Not having access to information, to details, not having the control on the whole patient journey. So we're very much focused to help through our solution, Cloud for Health. So the healthcare providers can actually work on some pillars, and those pillars are pillars that are going to improve the patient experience, the healthcare team. So if we have a challenge with few healthcare professionals, but they're very much admired, but now more than ever, we have to actually value them. The pandemic also helped us see the importance of healthcare workers. And if we have a restriction in the number of available healthcare professionals, and we have a striking need of specialization, where can we get and seek for things to improve the process? So we have data as one of the springboards, so to speak. We have several springboards. One of them is telehealth. Things are changing. access to healthcare. It's not our focus. We're talking about transforming data. If we take an example of St. Luke Health Partners in the US, what have they done to value data? It's hard to say how much it's worth. It's how much you've done with it. In this case, they had a savings of $400 million in 2 weeks. Imagine $400 million. Imagine that in your bottom line as a healthcare manager. How much have you earned? So identifies 5.4% of points based on a summary of the historical data of all electronic medical records. With that, they stratify the risk based on reimbursement, laboratory data, all those points. And with this, they managed to use AI and make a healthcare analysis projecting diseases and future costs. Only this allowed them to have such savings. This is one of the various possibilities to allow you to have great revenue. Is it using data? No, it's saving on one edge. We say that ultimately the profit is if you spend less and you make more money. But we have other examples that we can look at. Also avoiding cost. Shanghai Children's Medical Center, it took a clinical data repository and made an analysis of medical errors, identified that up to 11% of cases had this kind of error, and they started taking various actions in terms of process, reducing average stay time by 3% and avoiding rework that give additional revenue for them of 10%. Also significant. Just processes, only data analysis or analytics. We have other sources. If we take something that is really nice, that has been done by St. Joseph Health Center in the US. They have, so it's one different hospitals, different data. They did not integrate the data. They simply had an integrated dashboard for reports for all hospitals. Integrated dashboards, not integrating data for other things. This led them to have $1 billion savings a year. So if we think about that, so we're talking about things that are just processes. How can we make a difference? Handle something new, as you were saying. We have new things to create for a new treatment process. So you have wires that is a diagnosis provider using AI, Microsoft and machine learning. It makes an analysis of preventable blindness due to diabetes. They created a solution using existing data and led to 97% prediction in images. This can be offered to the market as a differential point that will bring a new type of treatment and perhaps allow you to have a new source of revenue. Microsoft is also working. We recently acquired Nuance. It's a great provider in the area of AI for clinical environments. One of the things that we're going to provide with them that is transformational is you're changing the doctor's experience. And today, with all due respect, this is not a complaint as a patient. It's just a finding of something that happens. Today, every doctor is becoming digital. First thing, when you get to your clinical visit, the doctor is talking to you, it's at 37 degrees, and they're actually typing, so entering data. Why? Because they have to fill out the clinical record. They're going to be demanded for that. And is this experience the experience the patient wants? And so how can I help doctors? This is what we're working on now. So use voice recognition that we have now, combined with semantic analysis. So I'm saying several things, and I say, I have 37.5 degrees of fever. This actually moves or changes the clinical record. This enables that to a better experience for a patient. I'm looking at you. You can see that I'm looking straight to the camera, looking straight to you. Apart from that, they may also empower doctors, tell them, well, based on all these symptoms that the patient mentioned, 90% probable or likelihood of being dengue fever, we recommend such and such tests. So this is empowering, transforming through data the experience of patients and the practitioner that is actually seeing the patient that will need some assistance, even in radiology analysis. So I started my career working for Toshiba Magica or medical with MRI and PET scan, also developing software for EEG, but this was a previous history. Anyway, I've always been in love for these things. This is what? A power for us to watch based on this data of millions of people and feed so that it can empirically say likelihood that this could be your diagnosis is this one, 75%, 90% likelihood. This is to empower doctors. We're not going to replace them. We're going to empower them so that they can be much more accurate and perhaps have personalized medicine application that is data-driven over time. Sometimes you have combined symptoms, but if you look at your past history, these combined symptoms will tell you that you're going to have adverse reactions depending on the treatment. I am a layperson oncologist, Dr. Marco, for what I've said. I'm just a passionate person with what I'm saying. So I believe there is a gigantic opportunity for you to use available data today and explore this. Wonderful, Rogério. Very good for you to have brought this topic, accuracy of diagnosis that is data-driven. I'd like to bring up this topic of accuracy, personalization. We talk a lot about this, and I'd like to know from Marco. So we mentioned in one of your interviews that research, innovation, and science are priority topics within the group. I'd like to bring to this panel a bit this idea that data collection through those intelligence technologies. So we have data acquisition source that is very promising in distant monitoring of patients, both healthy and sick. And there is synergy with this data management of your insured beneficiaries, not only in hospital environments, but also outside the hospital environment, led by this trend of care partially migrating from the hospital to closer to the community and the homes of these individuals. Can you share with us, Marco, how has Americas been preparing for this new reality that may actually generate numerous opportunities actually for this audience that we have with us, for this data value generation for the group and for the individual, obviously. And I should take the opportunity of understanding what this is like in the US as you have lived there.
Well, we will be late for dinner tonight, won't we? Because to talk about everything that you mentioned, and remember, I am a medical doctor. I am a minority here in this panel tonight. And maybe my depth in technology is really superficial compared to the excellency that you have brought to the market with Gympass and this new revolution that you were talking about. So I will quickly just mention what I wanted to say before. When Gympass was concerned with how they would overcome their business problem, because it's business after all, what we're talking about, we from healthcare, we're not the healthcare sector. We are the persons that take care of sick people. We were alone. Everybody disappeared. Nobody had a solution. Nobody had a treatment. And we were left alone. And in 2 weeks' times, we had to make decisions as well. And the results of our decisions were not only related to the sustainability of our business, but also the sustainability of society. Our decision would define who would live and who won't. So the speed of information, the speed that this disease brought to care delivery services of critical patients was absurd, unprecedented, was weakening in a way. In our company, we went from 0 to 1 million, more than 1 million telemedicine appointments. We had no regulation. We had no technology. We knew nothing about this. We did it at home. We created, what about non-COVID-19 patients? Strokes took place. Diabetic patients are still diabetic. What about the rest of the patients? I'm a cardiologist. And we see patients that had a heart disease or had a infarction or stroke. What about these patients? So the speed, we implemented everything. And I'm not only talking about the fact that it was the only solution possible, but data is essential. Technology was essential. And we had information. And one of the different things that is different from the United States is that in Brazil, you go to the doctor when you feel bad. And in Brazil, we have the emergency protocols, which has no schedule. It's available 24 hours a day. And then we have the critical patients. So we have the outpatient facilities, we have the emergency rooms, and we had to make our patients, in your case, the gyms, in our case, ERs, and see our patients in a different way. So that is one thing. And as far as data is concerned, just to give you an example, and this brings me back to purpose, we create value through medical quality excellence. There's nothing that can replace this in the equation. Quality, which you deliver in medicine, life equals life, quality equals life, compared to operational cost. You generate value and you establish a price, you establish a cost, quality, cost. Most systems in the States and Brazil, everywhere, deal with cost. How can you decrease cost in the equation? This is the wrong approach. It's a downward spiral. We defined cost early on and full quality. Total quality is our number one driver. Our number one purpose is to deliver quality. And we need to monitor this. And 3 years before I got here, I'm talking about things that started way before myself. We have 800 clinical data that monitor quality across the country in Brazil. For each patient, in each unit, tremendous investment, a lot of work, a lot of interoperability difficulties, but we won't give up and we're still monitoring quality. And survival is another important data. Survival is not talked about in Brazil. Nobody talks about survival in Brazil. It's a piece of information that, from my perspective, survival is an essential indicator. And we need to include survival in our references. We make decisions on treatment type, where the treatment will be delivered, the right operator for the right person at the right moment, the right medical doctor with all technology available to treat this patient and generate what? Generate value. So we use data like this. I am a manager. I am head of medical services and financial sustainability of UHG Brazil. So we created a depth of data, and each SKU that enters our company, we perform a management approach that reduces waste. In healthcare, waste is tremendous. And if we reduce waste, we will reduce undiscriminate use of drugs and medication. And actually, we launched a campaign and we called our co-workers from other companies to help us in this initiative to cut waste. Ask the right question with the right purpose and access to information. So we had the capacity to perform a clinical management based on supply chain data to reduce drug waste, cutting 5 days cost in 1 week worth of technology and information transfer. We could really save waste equal to 5 days. So we could really say that data is part of our daily life, of our daily world. We talk about data when we talk about clinical management, financial management. We're always matching data. And my last comment has to do with precision medicine. It was my project at MIT. I designed models, and precision medicine cannot be contradictory and contrary to the idea of population health. They're two interrelated ideas. Population health is an association. It is a definition, as we were mentioning before, in which a group of patients with certain markers, and there is an association of these markers with the disease. So you can anticipate a disease of this patient or a critical stage or the need of another treatment. This exists in medicine, in cardiology, in neurosciences. I mean, it's not a new thing. The new thing is to use this in a preventive manner, as is Gympass. Gympass uses these technologies so they can treat this patient, your athlete. I mean, your athletes are my patients tomorrow, that we can try and win the battle of prevention, because there is a problem in the business proposition when they are not interrelated. So we have all of this background and track record in data use. But in medicine, we're not organized in a way as we think about the beginning to the end, a human being's life cycle. Every human being must be taken care of since childhood. We have daycare centers, and till the end, the final moment, 60, 70, 80, 90, 100, we're here to make all of us live longer. And of course, we need to use data with firm purposes, and that's it.
Great opportunity, Marcos. Actually, very much in line with the purpose. I think we're moving forward. I would love to have this reality in Brazil, or at least be alive to see precision medicine being practiced by all of us. I'd like to comment the following, that our time just flew. This is almost the end. My final comment, which is, despite the fact that we don't really know for sure when we're actually going into this age of precision medicine driven by these intelligent technologies, well, I'm very optimistic. Optimistic because the people that we have here today in this panel are agents of this transformation, and you watching us can also be a transformational agent so that we can live longer and better, as Marco put it quite well. We're going to get to the last question and to close. We have this eager audience for knowledge and to know in a very practical way what final message or takeaway message you would leave people attending this panel for those that want to start their data transformational journey. So transforming data into assets in their companies. How do we start? How do we demystify the use of data in a simple way? How can we transform data into a strategic asset? Briefly, survey carried out by MIT shows that companies that base their strategy on data can have revenues up by 5-6%. What would be the focus? Claudio, you first. Excellent question, because every time we talk about many opportunities, well, actually, it's been very inspiring to listen to Marco and also Carlos and you, Leo. I've had several ideas during our chat that simply fled. And I'd say that first is, first of all, you must have a purpose. It's very easy for you to be enticed, and I'm going to record all the data, and then I'll see what I do. Then I'm going to add this filter, this marker. Okay, start with the hypothesis. How can I generate more value to my business, to society, to my end consumer, to my partner? And from there, draw a strategy for you to attain that purpose. Second thing is infrastructure today is no longer a limiting factor. Sometimes people ask me, well, I'm a small company, I'm starting now, I'm a self-employed person, I'm starting now to demand a culture more data-driven. Doesn't matter whether it's cents or millions of dollars a month, you can have a state-of-the-art structure that is going to support all your strategy of data collection, storage, handling, treatment, and analysis of data. So Microsoft has several programs that are free to explore some products, and several partners that also provide that. And lastly, I would also say that we have to reinvest in knowledge, whether we like it or not. This is quite recent science. Concepts are very sound, but the dissemination and the need for specialized professionals today is a critical thing. It's no use having good strategy, good infrastructure, if I don't have my team and my customers, my partners aligned with the right professionals to help us extract value from data. So I would say that purpose, infrastructure, and specialized professionals in data science that are actually quite scarce in the market. Let us train more, let us educate ourselves more, because there is great opportunity to have more professionals in this area. Excellent, Rogério. Up to you. Well, wonderful answer, Claudio. I'm going to use a couple of things that you mentioned and give you a different viewpoint. One of them is training data scientists. We're working very much on that. Microsoft is investing to train over 5 million Brazilians. This is an investment it's making in the country for free. See, look for that. It's available. Various courses and training courses for people that want to go into this area. Well, apologies for the marketing, but I think it's fundamental to show you there is a move towards changing it. I've seen several companies doing this. Food said that they're going to do that. As large companies, we must work to improve Brazil, to train Brazilians in provide education so that we can transform our country and raise our bar. Apart from that, Claudio said something that is interesting. Infrastructure is indeed not a problem, even less for startups. So you have to be a startup. You have to set up a business. You have no money. Start in the cloud. Totally digital. Because the problem before, the great barrier was, well, I have to spend money. I have to set up a data center. It's 24/7 operation. Cannot fail. I have to have service. This no longer exists. As Claudio said, you find sometimes you can get credits, cloud usage up to a certain amount, value or amount to totally free. So business for startups is moving worldwide, also because of that. The great opportunity. The other thing that I'm going to say, I'm not going to disagree with the purpose. Purpose is something I strongly believe in. It's what moves us. I just will disagree with something. You don't need to have a purpose to use data. Why? Let me make a sort of funny analogy, the data lake. We talk a lot about that. It's like fishing. The purpose is fishing, but you don't know what you're going to fish from there. Maybe you can fish something different. So what do I think is interesting today? If you have data, and this actually, what you said a bit earlier, you started recording everybody, and then all of a sudden you start making analysis and get insights of things that you hadn't thought of. But let me fish from my data lake with something like that. And the most interesting thing for this is that with AI, we start being able to seek in this part of data relationships that sometimes in the probabilistic science we wouldn't be able to find in a mathematical model. I'm going to speak as an engineer. A mathematical model is that you have x, f(x), and the result. A function of x that you created to define what that is. If it is a log function, whatever it is. You're going to define what your result is based on your function. And so what we're doing with AI and data intelligence is that I have a whole bunch of information, a lot of results, but I don't have the function that correlates both. What is this function? This is AI that is going to discover, and then you're going to train your model and say, well, this model gives me 98, 99% accuracy in the results. I separate this data and I train. And then I take the other data and I check. Well, the data are confirming that I've trained, yes. And it created a formula for me that I didn't have. And this formula may be set up sometimes with a purpose that it sometimes do not have. You don't even know. It's something to be found. So I believe that based on this, data is cheap for you to store. Cost of operating is also cheap. Protecting is important. But it's something that is also feasible. I think that based on all of this, you have to benefit from the opportunity, or seize the opportunity of storing data, and then have people to make various analysis. And this purpose may happen and may come up over time. Specific points we are renewing all the time. Dr. Aurélio Costa mentioned it quite well. Great part of it is avoiding waste, creating value from excellence and medical quality. Sometimes you have ideas and parameters that we're going to create to make this analysis that you didn't have before. Because if you record it later, you may lose some background information that will lead you to having a better result. The purpose is fundamental, but I'll say that you don't need to have the purpose as to how the data is going to be stored. You may use this for later discovery. This is just what I wanted to add to your answer. I thought it was great, just to give this different viewpoint. Marco, your final remarks? What do you think of all of this? How do we start? Obviously, I want your view of a great provider. Let's imagine not only great provider, let's think about smaller providers too. How do we lead to this transformational process?
Well, I just wanted to talk about a thing that you asked before in science and innovation. We are still working on that. I think it's the essential pillar of any of the companies present here. It's the discovery process, the questioning process, the fishing expedition, the search process, and much more in science. You still want to be part of the process. Even though you can be a small company, we're a private company. And we did our scientific homework. We discovered in the middle of the pandemic, and we tried to focus and we never gave up. So we are an important company in Rio de Janeiro, maybe one of the most important in the country and maybe in Latin America. We have a complex in a neighborhood here in Rio de Janeiro, but we can't ever forget science. Much more now because of what's going on. And with reference to what you mentioned, I think that everything starts with a human being. There is a technique called human-centered design or design thinking. And this is the information we have at MIT that shows that in design thinking and engineering, you know that this is neglected maybe nowadays, but everything starts with a human being and everything ends with a human being. unfortunately, in healthcare, we have to take care of the human being. But Gympass wouldn't exist if the human being were not interacting with technology and data. And you're trying through data to discover insights, to add value, to deliver a product for a human being that wants to consume your product. So the purpose goes through the need to design and the insight of a human being. And if smaller companies today do not create a product and then create a purpose, you can't go that way. And of course, we need to look at data. This is also truthful in the context of larger companies. You have a data bank and you have great opportunities with your data. But a company has to find a purpose, a larger and overarching passion that can guide you. Everything till you get to that moment is trial and error. And if you don't have a purpose, you can't always be looking for information. And the only thing you will have going for you is luck. But you need a strategy, and you have to start and finish your process with the human being. We can't forget that through the insight provided by the sense of purpose and what you need to deliver, you have to use data accordingly. There is no capital issue, no infrastructure issue, or access issue. All of us have access to information, but we need to understand what's the purpose and which are the real insights human beings need to make a difference in the medical and social life of the human being. That's my last comment. Thank you. Great. Sharp on the clock. Thank you. Thank you very much. Claudio, Marco Aurélio, Rogério Boros from Microsoft. Thank you very much for sharing with us your insight, your experience, a fantastic debate. Thank you very much. I congratulate everyone organizing at the FIS initiative for this great summit. Thank you. Enjoy the